Hi, my name is Dr. Siddharth Sahani. I am a senior consultant breast surgeon at the Indraprastha Apollo Hospital in New Delhi. My area of specialization is cancer of the breast and non-cancerous conditions of the breast as well. And this, as you know, is the largest and the fastest rising cancer amongst women in the metros in India. We therefore need to talk a little bit about it, and I'm going to discuss some points on awareness and what we do when we do find a cancer and the need for surgery in breast cancer. Now, breast cancer surgery has been known to man since about the 3rd century BC. It was first described in the annals of Hippocrates as surgery to remove the breast using a flame. And this technique was slightly improvised upon over the years as surgery developed, and till about 1892, when the first operation for breast removal for breast cancer was described. It had various forms, but what was surprising was that whether the cancer was discovered at 1 centimeter or whether it was discovered at 10 centimeters, there was only one treatment available. And unfortunately, in spite of the breast being removed, not all the women survived. In 1968, a new revolution in thought took place, which changed the entire paradigm of the treatment for breast cancer, the way the disease was looked at. We can actually just remove a part of the breast, which is called a lumpectomy or a wide excision or a quadrantectomy. It depends on which part of the world that you're in. And he showed that by doing that, the long-term survival in women was the same as when the breast was removed. And of course, there was a huge psychological effect in women with this finding, because they realized that if they discovered the cancer early, they didn't need to lose their breast. So breast conservation was firmly established and has been a scientifically established surgery since 1981, when the first results of a massive trial came out. Various trials in the next decade just underlined the same point. The point to note here is that breast conservation is not a cosmetic procedure. Very often it is felt that if the whole breast is removed, then the cancer will go away. But the same applies to conservation, wherein we take out the lump and a small part of the tissue around it. But this is a procedure which is only applicable to what is called as early breast cancer, which is really defined as a lump which is 2 centimeters or less, with no obvious lymph nodes under the arm, which are an integral part of breast cancer surgery. It is therefore the same thing as doing almost a laparoscopic or a keyhole removal of the gallbladder versus a big cut which used to be done many years ago. The operation and the indications of the operation are the same. It's just when we should use it. In the West, it is very common. It's done in about 80% of all breast cancer patients. And the reason for that is that there is a lot of awareness, and women go for what is called a screening mammogram, where the average lump size is between 9 to 11 millimeters, which is picked up. In India, the situation is a little different, because there is no national screening program in place for breast cancer, and the awareness levels are not what they should be. So women who are not very proactive with their own health don't go for mammograms regularly, and there isn't a lot of self-awareness amongst both the lay or the non-medical community as well as the medical community. The biggest risk factor for breast cancer development is the fact that you are a woman, and only 10% of breast cancer really is inherited. 90% of breast cancer happens in women who have no known risk factor or any hereditary tendency. So anyone and everyone can get it. In India, currently the estimated risk for a woman is that 1 in about 15 women in a lifetime will get breast cancer. That is that's even higher in the metros, which we estimate to be between 1 in 9 and 1 in 11. So typically a woman in Delhi has a 1 in 11 risk ratio of developing a breast cancer in a lifetime, which is amongst the top 10 risk ratios in the world. The highest is in, of course, America, which is 1 in 7. The age in India is also about 10 to 15 years younger than in the West. The maximum incidence that we have observed is between 42 and 46. And of course, now that we live old, much more into old age, it's the over 70s who are also at risk for developing this disease. So please get yourself examined regularly by a doctor. It's once in 6 months. Do your own examination, which is once in a month. And if there's any change, please go to your doctor. And once every year after the age of 40, please get a mammogram done. Obviously, if this awareness is increased, the chances of finding early cancers is also increased, and therefore at that point you will not need to lose your breast. If, however, the cancer is found later, then due to either problems with the size or the position of the lump, it becomes impossible to save the breast, in which case we have to remove the whole breast, which is called a mastectomy. Now, a mastectomy can be done on its own, or if it can be coupled with what is called immediate reconstruction, which is where we use either parts of the body to fill in the defect on the chest wall, or we can even use things like silicone implants or what is called tissue expanders under the skin to blow up the skin sufficiently to be able to take either a body part which is used later or a replacement with a silicone implant. This is done essentially to give psychological benefit in terms of recovery for the woman. It has no impact on cancer recurrence. So even if the breast is made during the surgery or even later, both of which are possible, it has no bearing on the cancer coming back, because even though it might look like a breast, it is not a breast, and it doesn't actively participate in recurrence of the disease. So this is a decision that needs to be made based on what type of cancer you have, what stage you have, and what are the facilities available where you're doing it. Obviously, no woman likes to lose her breast, but it must be safe enough to be able to do. Then there is a question of what should be done with lumps that are not cancerous. Now, having a breast lump doesn't necessarily mean that you have to get rid of it. If it is investigated properly preoperatively and deemed to be a non-cancerous lump, it can, most of the times, it can be left alone and it'll wither away with time. It won't disappear, but it'll wither away with time, typically after menopause. There are some conditions under which your doctor will recommend that this lump, although not cancerous, needs to be taken out, but those are few. And the operation for that is very cosmetically acceptable to the patient. If, however, you feel that you are very uncomfortable with keeping the lump in your breast, then it can be removed. It's a daycare procedure where you come in the morning and you leave the hospital in 6 hours. There is no role as such for laparoscopic or keyhole surgery in the breast, although various trials in France and Japan have been done to see whether it can be made as a de rigueur or par for the course. But because the breast is such an accessible and an open and readily assessed structure, there is no advantage that the patient has in getting laparoscopic surgery done.